growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi, everybody. Dr. Steve Rasner here, and welcome to the Lionhearted Dental Podcast. Hope everybody's off to a pretty strong year. I've mentioned to you I'm not. I like to keep it real. And the month of January wasn't so kind to me as it was in January 2021. I know why. Lack of new patients, quality new patients. And I've talked about this in other podcasts. And all I'm going to tell you is, pardon the expression, how I roll. Now, I've let it go for a couple weeks because I don't think a couple weeks is a trend. But I assure you that this weekend, I will begin working on new marketing because I feel like my old marketing must be getting stale. I'm not sure it's that. We are obviously in the middle of the Omicron explosion all over the world in the United States. And even though I hope it's beginning to wane, I certainly have a lot of patients that cancel because of that. And all of us are dealing with staff issues, and it just doesn't feel like we hit the ground running January the 1st, 2022. It doesn't. It feels like there's too many excuses getting in our way. And that's always going to be the case, by the way, in your careers. There's always going to be a new something. Granted, this pandemic pretty much takes the cake in my career. But there'll be a recession, there'll be disappointments, there'll be other things. And it's your job to overcome all those things. So I assure you this weekend that I will be writing down a new radio ad that I do personally. I'll be putting together a new direction for my hard copy advertisements and things like that. But I just wanted to tell you, I've told you before, I had an amazing 2021. I did. It was record-setting for me. I used to get on here last year, and I would name all these crazy podcasts after a great week or day I had. And that included last January, but it has not happened to me. So sometimes I think it's good for you to hear that even a supercharged office like my own can be off. Doesn't mean 2022 is going to be off. Certainly January was. And if February started to go that way, I'm not sure what I would do next, but I would fix it. And I will let you in on it if that's the direction it goes, which I seriously doubt. To some, I think it's a combination for all of us of what I just said. I do think the ongoing pandemic, the economy seems to be in disarray in the United States. Inflation's out of control here. There's a lot of real issues that can make the consumer put off dentistry. It's the truth. So that brings me to my subject tonight. But before I do that, I do want to make an announcement. Sometimes I host really enticing, cutting-edge speakers, and I will be doing so October 14th of this year. So you have 9 months to get it together. And in the hotel next to my office in Vineland, New Jersey, so most of you would fly to Philadelphia, and then you would take a 45-minute ride or Uber to the Hampton Inn, which is right next to my office. And I'll be hosting Dr. Richard Moran. Probably if you are interested in bone regeneration, PRF, anything connected with growing bone, you have likely read something by Dr. Moran that you might not even know it was him. He's incredibly well published. He's a good speaker, and I am honored to host him right next door to me. And if that's not enough, I'm also combining that with Dr. Ihab Musa, who is a periodontist from Louisiana. So look these guys up. Dr. Richard Moran, M-I-R-O-N. and Dr. Ehab Musa, Moussa. And I've heard them both live before, and they're superb. I mean, I really think it's going to be a pretty amazing 2 days. That's October 14th of 2022, this year. And my own courses, live courses, continue to sell out. So if it's those of you that have been didactically trained in implants that maybe it was 8 years ago and you just let it go, and you want to get the leap back in, I will keep you safe and sound. It is not intimidating. I've gone out of my way to create an atmosphere that's embracing, that makes you feel comfortable. I know how scary it is to do surgery in front of another colleague when all you've ever done is whatever you've done in your own office. It's intimidating. And I've taken many steps by the instructors I have besides myself, by knowing as much about you and your history of implant placement, which could be zero, by the way, so that I hand select cases for you from beginning to end of the 2 days. So I'm not going to throw you to the wolves and act like you're all the same, because you're not. And if you're going to pay me money to take this step, it's my responsibility to deliver a program that's not only challenging to you, but comfortable to you. And I take that very seriously. The same exact goes for my extraction and bone grafting courses, the same philosophy. We don't want to intimidate you. We're not going to think, oh, this guy doesn't know anything. Not the opposite. We want you to leave with confidence and tell your friends about the Institute. So you can find those dates on the Rasner Institute. What I want to talk about tonight, however, is probably the most important thing we could talk about. And I don't think I'll get through it in one podcast. And I'm going to call this Reasons Why Your Case Presentation Stinks. Now, I know I could have said it nicer than that. I actually thought before I came on tonight, how should I say that? Well, I'm tired of being mousy. A lot of you don't do the job you need to do to make your case presentation explosive. Of all the things that you could sit me down for and go over with you to make it better, that would have the greatest impact on your practice now, immediately, next month, next year, forever, how could it not be all the factors that go into case presentation? So I'm not rushing this, and I don't know how many podcasts it's going to take me. It's going to take what it's going to take. So let's get to it. Well, let's first begin with, what's the big deal? I know we all know it's a big deal, but I don't know if you know it, how big of a deal it is. It's everything, guys. I need you to think about it for a minute. Think about this right now. Think about what you're walking into tomorrow or Monday, if this is the weekend that you're seeing this. What kind of schedule? What kind of productivity? How many patients you have to see each day? If it's challenging, if it's frustrating, everything you do every day, whether you have enough cash for payroll, whether you have enough cash flow to enjoy your life and reward yourself for this not so easy profession you and I chose, has everything to do with case presentation. You could put me in a hut as long as that hut was clean. In other words, you could put me in the most conservative office of anyone listening. As long as the equipment was functional, tidy, clean, Walt Disney clean, I could teach you how to maximize your potential with that given patient, which is what you need to do, I'm going to be real here, in the 45 minutes to hour and a half that they're in your office, talking about that new patient experience. So why is it a big deal? It determines absolutely everything you do every day. If you don't have case presentation acceptance, then you're doing myopic one-tooth dentistry, maybe 2 or 3 tooth dentistry for a career. And that leads, obviously, to a lack of fulfillment and burnout. So I thought about it before I came on. Why would yours case presentation be substandard or be not what it could be? Or as I put it, stinks. Well, number one, your branding, the number one, not the most important reason, one of at least 7 to 10 reasons I'm going to give you in the next couple of podcasts, is that your branding, in other words, the marketing of your practice is absent. It's not visible. It's not palpable. Even if you have a campaign, you don't have a campaign that delivers a message. So anybody calls you, it may just be because you're on the insurance list. It's true. We all like word of mouth. I get that. But that's not where all of our patients come from. And it's your job to put the message in the community of who you are. And there are other podcasts I've done about branding. We've talked about it many times. And all I'm going to say about that is this. The top 3 things for you to brand are a sedation practice. Now, if you don't want to do that, I have 2 others. But that's the most powerful one you could ever brand. Because I am 100% convinced, after 4 decades of doing this, that the most common denominator of patients from here to every country, to all the 25 countries that listen to this podcast, is the fearful patient. In Belgium, Mexico, Brazil, UK, United States, all of us. Everybody listening has people in your community that are not having dental care because they've gone somewhere in the past and it's not been pleasant. And they've developed these real phobias and fears. And it's just astonishing to me why you wouldn't want to be a part of that solution. It just requires a permit that, of course, requires 60 hours of CE in most provinces and states in the United States. It's worth every minute you spend and every dollar it costs. The other 2 branding attributes of your practice that could never, ever be wrong is that the patient's listening and choosing to pick up the phone to come to you believe that you're trustworthy and that you are competent, that you have confidence. They have confidence in you, that you, in fact, will do an excellent job. Confidence and trust. They're 2 wonderful images. You know, there was years in my career that my message of branding was an appointment today. I've said this many times in recent podcasts. An appointment today. And I thought it was brilliant when I did it. And it may not be a terrible idea, especially for a younger dentist that's opened his practice and has openings in his schedule. It's probably where it came from 35, 40 years ago for me. An appointment today. But the problem with that approach, and I'll tell you ahead of time, for those of you that may want to try it, is that it attracts many emergent type of patients, emergency type patients. And emergency type patients often are always emergency type patients, unless you can turn them around. And in one of my recent podcasts, I talk about that patient is called the hidden jewel patient. It's a hidden jewel because everybody thinks of the emergent patient as a pain in the you-know-what, because they always show up with an explosive pathology, a very swollen mouth, incredible pain often. I mean, not a great way to start a comprehensive relationship and approach to their oral health care. How could you if they have a low-grade fever, have swelling, etc.? So I want to repeat that. My branding used to brand to that because I was trying to grow and get busy. And it's true, because 40 years later, I don't seek those type of patients because I don't have to. But I will tell you that when I did do that, and it could be appropriate for you, if your schedule's open, we used to deliberately, even at the end of that campaign, a couple of years into it, we would deliberately leave 1 hour open in my schedule every day for that emergency patient that was going to call. Is that amazing? I think it is, looking back. It's been a long time since I had to do that. So one of the reasons, the very first reason that I'm giving you that your case presentation is failing, in other words, you're not getting a high ratio of case acceptance, is because people just come into you randomly. There's no reason specifically to come to you. And think about that. Every major company probably that you do business with has some theme that attracted you. Okay, let's look at affordable dentures now. I don't know what their profit and losses are, but I have a lot of patients that end up in my practice that started at affordable dentures. And affordable dentures' name is their brand. It is the last thing that I would advocate on the Lionhearted podcast. Under no circumstances do I think that's a good idea. Even if the CEO and every dentist that works for Affordable Dentist makes $1 zillion, God bless them, quantity over quality was never something I was interested in, and never, I don't think anything many of you are interested in. So your branding is a big deal of who ends up in your office. The second thing that goes right along with that is that you don't screen your patients. You don't have a system to screen the people that do call you. Now, isn't that a little ironic that I'm saying that? Because some of you have an open schedule, and maybe it's rude of me or short-sighted because it's been so long since that was the case, where I had open schedules. And maybe I just don't remember that mentality. But I would say to you, I believe strongly that it is important to screen. And I've said this to you as well before, because we only have the hours of each day that we have, right? And some of those hours have to be spent with new patients. Well, if a patient calls you on the phone and has a heavy insurance-based attitude, and we all know what that is, I haven't written anything on this because to me it's so apparent when that patient fits in that category that we're not a good fit. Oh, I don't want any x-rays. I just won't have that done. Oh, okay. Well, time's precious, so probably wouldn't be best to come to this particular practice, etc. To be honest with you guys, I don't know exactly how Michelle tells a patient. Maybe she refers them to somebody I don't know right now. That I guess in our particular community, there are urgent care centers and urgent dental care centers. Perhaps that's where she sends them. I would think that would be the case. I don't think she would just not recommend an office for these type of patients. This is what I know. I know how disappointing it is to walk into a room with somebody that somehow slipped through the protocols that I want screened and have a patient that has zero interest. I don't want to talk anybody into good oral health. I want the patient to want to have good oral health. Now, that doesn't mean they have to have 32 teeth. Doesn't mean that they have to have them all beautified and aligned properly. But having healthy joints, healthy periodontium, no cavities, no active pathology, abscesses, I don't think that's a stretch. So you can't get to that without doing a comprehensive exam. So I guess one of the reasons why I think some practices come up short on case acceptance is that you'll take any patient that calls your office. And that may sound cold. I know I just said that to you, but you either want to be productive and use your time accordingly or not. And if you think about what I just said, the branding part of your journey is an important part. It is never too early for you to be able to afford appropriate marketing. So obviously, that's what's driving people to our practices. The third and probably last one that I'll cover with this podcast is that you don't provide enough time, nor do you have a systematic flow for the new patient. You don't provide enough time, and you don't have a system. The system begins, for case acceptance, with the person answering the telephone for the very first time with the patient that's calling the office. That's where it starts. And if that's a random non-event to you, I assure you that we don't have a background music when they call, welcome to the practice song, but it is a very inviting conversation done by a staff member who understands the power of the new patient. You better understand the power of the new patient. So it is an event. How long do we give them? We give them about an hour and 15 minutes to an hour and a half. I would never give them more than that. But based on the conversation, but I will never be upset with my front desk scheduler if she thought this particular patient based on the screen. So this screen, by the way, which I jumped over, is an opportunity in that initial phone call to get as much information without them thinking we're stalking them over the phone when they're coming to the practice. And it involves a series of, in our case, about 5 questions we ask that I have available to you, by the way, that gives us a very clear picture of who's coming in. You know, another reason, which I don't have on here, is that you don't have a system to bring in the significant other if the new patient indicated need. These may not sound like a big thing to you, but they are everything. How is anybody going to make a decisive $10,000 plus decision if they have a significant other in their lives? They're not. And I know this, tell me how. Because the few times, well, I won't say it's that few. I'd say the 15% of the time to 20 that we can't get the significant other to come in. By the way, the significant other can also be a parent. So very often in my practice, it happened today, to be quite honest with you. So let me tell you about that. I had a new patient whose mother referred him. I treated his mother. So I had the kid. Well, the kid was 46 years old. This is a very common case for me. So 46-year-old patient in my chair with a jacked mouth, had gone, incidentally, to Affordable Dentures, came to us, and I'm glad I didn't plan on telling you the story. And the reason he came to us is because the $12,000 treatment plan for full upper, full lower dentures, which was their top model, was too expensive for him. That's what I'm told, partly on the intake information, what I just said to you. $12,000. Apparently, Affordable Dentures has a range of dentures, and this was the high end that they were explaining to the patient, and he actually cut the appointment short with them and ended up in our office weeks later. I'm not going to go into the great detail of it to you, but I will tell you that the treatment plan that I offered him was not full dentures. We were able to, under my examination, we were able to keep 5 maxillary teeth, some implants, and yes, a removable prosthesis, and some treatment for the lower as well, which, by the way, included the removal of 2 tori. So I don't know how this individual was ever going to wear a denture or even a partial without removing the size of the tori that he had, which, by the way, we teach in my course. I mean, I'm talking a serious mandibular tori. And that was part of my treatment plan. And it was well over 20,000, 21 something. And there was a moment where I got on the phone and spoke to his significant other because she couldn't be there. And there was no decision made today. And that's my point. Let me put it this way, and I want to end with this tonight. And I want you to really think, please, what I'm saying to you. It's really hard to get on the air every week and come up with something impactful. Because I know I go off on tirades and diatribes I don't mean to get into. But not tonight. This is focused. And it's impactful if you really think about it. What could change your practice, your personal life even, better than improving case acceptance? So why do I have it? And I do. Why is it so part of my Lionhearted practice? The answer is, it is because of everything I'm telling you right now. It starts with the branding. Of course it does. To the people in my community that are not word of mouth referrals, they are hearing about me through stuff they're picking up, and that's free giveaways in the local markets, by what I say on the radio, by what I have printed in the local newspaper. That's the majority of who comes in. And then that process, I understand, and you need to understand, begins with that second they call our office. From the way and systematic path that Michelle takes them down for their sake as well as ours. Because if we're not a good fit through the screen, then why waste their time? Seriously, why bring somebody in who we can't communicate with over the phone to understand the value of a comprehensive exam? That we're not going to just pull the offending tooth and hope they come back. That's not what I'm recommending to you. I'm recommending that everyone get a comprehensive exam. So I'm going to leave it at that because I don't like going over 30 minutes, and I am at 30 minutes. But I said I only gave you a couple today, and I'm going to do this next week as well. The big deal, I hope, how could anyone ask for a more important part of your success than a good case presentation, ratio of acceptance? But maybe your branding isn't strong enough. Maybe you're not screening well enough. This is just the beginning. Next week, I'm going to go into how much time it takes to do this properly. What system should you have every time? What about your personality? How fluid is your personality? How important is it that you look fresh? That you look and feel passionate about dentistry? Yeah, you can look bored. Do you get me? You can look uninvolved by your body and your eye and your voice. We'll talk about all that next week. Have a great week. Please reach out to me. I hope somebody's listening. It looks by the numbers that you are, but I haven't heard from many of you in the month of January. Have a great week. I'm trying to help. See you on the Lionhearted.